Hello and welcome to the channel where we discuss medical topics and lifestyle. Today's video is about gout, so everything you need to know about gout. We're going to be talking about the definitions of gout, the signs and symptoms of gout, the risk factors surrounding gout, and some of the preventative factors we will look at, the diagnoses and the interventions, and the management of gout. So let's get right into the video. So gout is a picturesque presentation of a uric acid disturbance. So let's get right into the definition of gout. It is the most well understood and described type of arthritis. So gout is a crystal-induced arthritis or arthropathy. The crystal in the description meaning that you have a lot of urate crystals that are causing the problem, and the arthritis means referring to a problem in the joints. So what happens is you have hyperuricemia, meaning increased serum uric acid. This then forms crystals that are deposited in the joint, which causes all the trouble. It makes the joint painful, it makes the joint swollen, it makes the joint red and tender and hot to touch. So this is what the excess uric acid in the serum does to our body, to our joints. Now, there are some common joints that gout affects more than others. So just like when you develop a cyst or something else, there are more prone areas to developing these things. In the case of gout, as displayed in the photo here, one of the main joints that gets affected is the base of the big toe. That joint is called the MTP joint. In other words, that joint is called the metatarsophalangeal joint. So that's probably the most common joint affected by gout, the base of the big toe. But it's not the only joint that gout affects. So it's not the only joint where these crystal deposits are forming. So throughout the rest of the body, there are a few other hot spots that can be affected. The other one is the carpometacarpal joint. So that is the base of the thumb itself. There can also be bigger joints that are affected by gout, so it doesn't just have to be the small joints in the hand or the foot. There can also be gout affecting the elbow, for example, and also the knees or the ankles as well. So these are all locations where gout can form, the crystals can deposit. Gout doesn't just form crystals in the joints, but also underneath the skin. These are called tophi. So they are subcutaneous deposits of uric acid under the skin. These are shown by the yellow dots in the diagram. So these are under the skin, at the ear, the distal parts of the fingers, as well as the elbow. But by far the most common are the DIP, so the distal interphalangeal joints at the end of the fingers. These are the most commonly affected ones. So now let's move on to the risk factors and the prevention side of things. So when it comes to the risk factors, what's going on there? Who is actually getting gout? So there are statistical factors such as male to female ratio of 5:1. It increases with age as well, but there is a typical profile of who is getting gout. Yes, there can be a family history component. Yes, there can be a genetic component to it, but the vast majority of people getting gout fall into the risk factor categories of obesity, excess alcohol intake, a high purine diet, so foods that are high in purine. And also there are other factors involved there as well. So certain medications can provoke gout, so diuretics, for example. There are certain cytotoxic treatments as well that can provoke gout. Diseases and issues within our bodies such as renal failure, surgery, ketosis, plaque psoriasis, polycythemia. These are all things that can provoke gout to occur. So the overwhelming majority of it is a lifestyle factor, but there can also be other things as well. And there's a high association and a link to hyperlipidemia and cardiovascular disease. So if we are thinking about things how to avoid gout or things that we can do, things that are in our control, it's pretty self-explanatory from a lifestyle point of view. Now let's talk about the diagnosis and the investigations that one can do for gout. So gout is more so a clinical diagnosis, but you can do some investigations. So you can do a blood test, which will show an increased white cell count, inflammatory markers, and the urate that we're talking about. You can do a microscopy, so you can aspirate some of the fluid from a swollen joint. And that's where you will see sodium monourate crystals on polarized light. There should be a U there. That's pretty interesting because If you see bacteria, then that means something else that we're going to talk about in a second. You can also do an x-ray, which can show extensive erosive pattern on severe disease, which is not something you commonly do. Mostly it's a clinical diagnosis, but these are the investigations you can do. One of the major differential diagnoses is septic arthritis, so this is something you need to watch out for. It is most common in children under the age of 5 years old and commonly affects the hip or the knee, but it can happen at any age, to be honest. The patient is usually systemically unwell and holds the affected joint completely still, and this is an emergency. So the joint may be swollen, hot, and tender. It's an orthopedic emergency. Off you go to the hospital if this is suspected. So this is the most absolute important differential diagnosis. So how are we going to manage this condition? How are we going to manage gout? So there's two aspects of it. There's the acute management of an acute flare-up of gout, and then there's the secondary aspect of it, which is prophylaxis and preventing it from happening again. So when it's an acute flare-up, what are we going to do? So we need to exclude infection, the main thing we discussed a second ago, septic arthritis and all that. We're going to apply some basic things such as raising the leg, applying ice packs, things like that. And then we're going to opt for painkillers to limit the pain and reduce the amount of inflammation. Usually the first line things are NSAIDs, so ibuprofen, naproxen, paracetamol. There's also colchicine as a second line treatment, and also oral steroids if none of that is working out. So those are the medications that we use to try and manage an acute flare of gout. Then the prevention side of things comes in, which is where we use allopurinol or febuxostat. So these allopurinol especially reduces the amount of uric acid. So keep in mind side effects of some of these medications. So just like any medication, a lot of the times you can get a bit of diarrhea with taking colchicine. That can be dose dependent as well. So just things to keep in mind and reading the leaflets at the back of packaging. When we are talking about allopurinol, then generally you can't start it when you're having an acute flare-up, but you can continue it when you're having an acute flare-up. So that's a typical exam question for you there. So you can't start it during an attack, but if you're already taking it, you can keep on taking it. And then there's the lifestyle component of it all. So how are we preventing it all from happening? So looking at causes. So stop the medications that are maybe provoking this. We spoke about diuretics a little while ago. Correct the lifestyle. So the diet aspect, the purine, the weight, the alcohol, all these things are considerable factors there. And then what we do later on is we check the uric acid levels in a few months' time to see how our interventions, be it with preventative medications such as allopurinol or be it with lifestyle factors, how it stacks up compared to our blood test previously, and then we tailor our approach further according to that. And there we have it. That's all you need to know about gout, pretty much. We didn't dive into chronic gout or other arthropathies, but this is, like we said, a video on gout, and I hope you learned something here and you can take it and use it in your day-to-day life. Again, the most important thing is the lifestyle prevention aspect of things. So like and subscribe for more. We will see you in the next video. Leave a comment in the section below, and we'll see you soon.